Claim denied, not medically necessary. Claim adjustment X12 code, 50. Reason these are non-covered services because this is not deemed a medical necessity by the payer. When you receive a medical billing claim denial for because the payer does not deem them to be medically necessary, you have a few options. Medical necessity is a crucial criterion for insurers to cover healthcare services. Check patient payment history. Review the patient's payment history to determine if the same ICD-10-CM diagnosis code has been paid for the same current procedural terminology, CPT, code in the past. If the payment history shows that the same diagnosis code has been paid with the same CPT code previously, consider requesting the payer to reprocess the claim since payment was received for a similar scenario in the past. If the payment history does not support the claim, inquire about the time limit for sending a corrected claim. Bill the patient directly. If the payer will not cover the services, you may be able to bill the patient directly. However, you should inform the patient upfront that the services are not covered and that they will be responsible for paying for them. Appeal the denial. You may be able to appeal the denial by providing the payer with additional documentation to support the medical necessity of the services. This documentation may include a letter from the patient's doctor explaining the medical necessity of the services, medical records that support the need for the services, any other relevant documentation. Denials related to a lack of medical necessity are typically assigned to the coding team for review and correction of the diagnosis code. Even if the time limit for sending a corrected claim is crossed, it is recommended to send the corrected claim with the appropriate diagnosis code once the coding team provides the correct information. If the coding team confirms that the diagnosis code is correct, the next step is to send an appeal to the insurance company. When sending an appeal, calculate the time limit from the denial date to ensure it's not crossed. If the time limit is exceeded, it may be necessary to write off the claim. However, client preferences may sometimes override this guideline. Tip: Medicare patients. Check the LCD or NCD prior to service to determine eligibility of services for patient. If the service being performed is not covered under the LCD guidelines, we encourage you to provide your patients with an ABN prior to performing these tests. Note: if it's not documented, it's not done, is a fundamental principle in medical billing and coding. This means that if a service or procedure is not properly documented in the patient's medical record, it cannot be billed to the insurance company. Query physician, don't guess. Examples of improper documentation: a progress note that simply states patient seen for follow-up, a medication order that does not include the dosage or frequency, a procedure note that does not include a detailed description of the procedure. Examples of proper documentation: a progress note that includes a detailed description of the patient's symptoms, physical examination findings, and assessment. A medication order that includes the drug name, dosage, frequency, and route of administration. A procedure note that includes a detailed description of the procedure, including the instruments used, the steps involved, and any complications.